So let's begin this first lecture and talk about wound treatment and the use of granulated sugar. This is not a new process. It has been around in military manuals, Army manuals, and been taught to special forces troops and others who might have to do battlefield treatment as a method as early as the 16th century. But recently it has had a revival and it's come back into vogue based on new research. So, dressings made of sugar, like I said, have been around for a long time. As you can see from the slide here, they favored by healers throughout history, fell into disfavor with the development of modern antibiotics. Is that once we got into penicillin and new antibiotic ointments and treatments, which were promoted by companies, sugar sort of fell out of favor. There were a lot of complaints people could make about it, but it basically had the benefit that even these modern antibiotics were not able to do the job as effectively as sugar. Modern preparations have proved unable at times to overcome certain types of bacteria, whereas just simple granulated sugar has been able to. As you can see here, it was used as far back as the 1600s and was used very effectively. And as a child growing up, I have seen wounds treated with sugar and have been most effective. As I said, Sicultatus in 1679 was one of the first people to talk about its use and how effective it could be. However, they didn't understand why it was effective. And when modern antibiotics came along, they simply, rather than trying to figure out why it was effective, they simply used the modern antibiotics which are being produced and pushed by companies promoting them. However, always as is the case, a lot of work coming out of Europe, experts have begun to look at this again and begun to use granulated sugar. The experts believe that what happens is that granulated sugar applied on the wound, now you want to use basic wound treatment techniques. You want to clean the wound, you want to remove any debris, but if you then pack it with granulated sugar, building a little dam with bandages around it and then covering it over, that tends to draw the water out of the wound through osmosis, sort of a drying effect, but it also promotes connective tissue. It also promotes less scarring of the site. And it is also antibacterial in that it disinfects and keeps the wound from becoming infected. And they've even used this with other types of wounds, such as deep ulcerous type wounds or old wounds that have become infected, and it's been proven very effective in terms of killing the bacteria, making the wound healthy, creating connective tissue, and reducing the scarring. Now, as I said, most of the work on sugar as use for wound treatment has been done in Europe. We've just begun in the United States to get involved with it, but in Europe, Asia, and in other countries, it has been used for quite a while. Professor Rudi Seward, the chairman of the Department of Surgery in Munich, said that the last 5 years the technique has enjoyed a wide renaissance in Germany and to a lesser extent the rest of Europe. You also find that it has find some uses in Asia and in Africa as well. In the United States, we have begun to look at this primarily because of one individual's efforts to revive it, and that is through a Dr. Richard Knudsen, orthopedic surgeon in Greenville, Mississippi, who's published one of the few papers on the technique, and that was about a decade ago. So sugar is making a comeback and is proving to be a cheap, readily available, and effective topical for open wounds and ulcerous type wounds in terms of helping to form new connective tissue, minimizing scarring, and bacterial control. Doctors alter the usual cleansing regimen by sprinkling granulated sugar or spreading sugar paste in the wound 2 to 4 times a day before applying new bandages. So your wound is clean, then you put new sugar in and you apply the bandages. The sugar liquefies somewhat. Now, you can also do this with the paste, and several companies have come out now that are using it in paste form. But doctors say the method, even in dirty injuries, often germ-free within a few days. One of the papers here you can look at is for Carol D. Matthews, Associate Professor at Wound Management in Ontario, Canada. They've published a paper. This is primarily looking at wound management in animal facilities as well as in humans. So it's a combination paper, but it's certainly well worth reviewing. They talk about the benefits of using sugar, granulated sugar, for wound treatment. And it is proven that, it has been shown at least, that in many cases, sugar can be very effective. So sugar as a wound treatment can show greater healing and infection control, and can show to a degree bacterial control, as well as reducing scarring at the site. So this old technique, which was around for 4,000 years, is suddenly finding new benefit. And one of the interesting questions that come up when we started talking about putting sugar into wounds was immediately people started asking about, what about people who are diabetic? Now, we've talked about this briefly, but let's talk about it in more detail here with summary. You're not putting sugar directly into the bloodstream. By putting sugar into the wound, you're simply covering the wound, using the granular surface to help block off air, kill bacteria, help the tissue regenerate, but you're not putting sugar directly into the bloodstream for somebody who is diabetic. So it's not going to cause diabetics to go into sugar problems, and it's not going to create any high blood issues, because all that you're doing is treating the wound itself. Even if there is an open blood vessel, the blood is going to be flowing outwards. You're not going to be putting anything into the wound. The sugar is simply there as a covering. So remember that. All right, let's move on to the next lecture.